Welcome back. Jesse Lula Schiceya, who is the CEO and founder of Patient Care, an organization that was established with the aim of ensuring equal healthcare access for all Namibians. It was created to address gaps in healthcare access in response to the COVID-19 pandemic. The platform enables individuals to have consultations with licensed medical specialists from the convenience of their own homes. Jesse now joins us this evening here in studio to elaborate a bit further. Jesse, good evening and welcome.
Hi, Nila. Thank you for having me.
Thank you so much for being here.
Awesome.
So interestingly, as I mentioned, this was a response to the COVID-19 pandemic. So take us back a few years, I suppose, when, the idea of patient care was in ideation stage.
Right. That's where the inspiration came from, the COVID-19 pandemic. Simply because doctors, I learned that doctors could actually consult with patients remotely using their WhatsApp calls, and thereafter issue a prescription via WhatsApp, and the pharmacy would accept this. So one of the complaints that doctors would have is that they're doing this for free and they're not being compensated. And then obviously later on we started seeing medical insurances and aids come up with telemedicine consultation, but yet again, how do you kind of manage that when I could have a phone call with you and just say, hey, I'm claiming for telemedicine consultation. So that's where the inspiration came from during the pandemic time.
Fantastic.
And when we built it in 2021, we did not launch because of regulations. So now that HPCNA released some regulations on this, we followed the guidelines to the T, and we launched on the 7th of June this year.
Fantastic. So what does patient care involve in a nutshell? Tell us about it.
Okay, so you kind of summarized it though. Right. But patient care enables patients to connect to doctors, hospitals, laboratories, pharmacies, and also we're creating a platform for pregnancy care and AI for mental health support, in a nutshell.
Awesome.
Yeah.
I'm interested in the AI in mental health support, so we'll come back to that in just a bit.
No worries.
You launched on June 7th, 2024,
Yes,
which
ma'am.
is almost, is it 2 months ago now?
Yesterday, yeah.
Exactly, yesterday. And you said you're in 2 other African countries as well. Talk to us about that and your plans for, expanding.
Right, so we are currently doing work in Nigeria and South Africa, and also we strategically hired people around Africa, so we have guys in Kenya, Malawi, and other countries, and with our team in those countries, we will then start scaling into Kenya, Malawi, Ghana, Rwanda, Uganda, Cameroon, and Ivory Coast, and a few other places. Yeah.
Fantastic. So if I'm a patient that makes use of the patient care platform, do I then have access to specialists only within Namibia or to the database that you guys have across Africa and potentially in the future across the world?
At this current stage, you want to keep it country-centered. So as an example, let's say you have to do work outside the country and God forbid you get sick and you don't have or you don't know the environment, it would be to your advantage to connect with your doctor through patient care remotely and still have that assistance, also keeping it in your currency. So at this stage, it's locals connecting with their local doctors. However, in the future, we're looking at expanding that, and that part is a gray area for us because of regulations and all these sorts of things. So we'll see how we'll do it. Yeah.
You mentioned earlier why you didn't launch. Of course, it was COVID times, and also there were very few regulations around telemedicine and I guess virtual consultations. And so now that there are sort of regulations in place, this has enabled you to be able to go forth with this. So how then would you then monetize this? How would you charge patients? Would it be the standard procedure? When you go to your doctor physically, how does it differ?
That's a great question, thank you. So it costs you $100 to consult with the doctor on patient care, which is roughly about 80% cheaper.
Right.
And at your convenience, it could be at work, could be at home, could be on the farm, could be on a boat, maybe not on a plane.
Yeah.
But yeah, so it's $100, and the model we've created is to ensure that doctors also get revenue from this. So we have a revenue split type model with them. So what that means is doctors can earn up to 15% more of their salary if they choose, especially looking at millennials and Gen Zs that love remote everything.
Right.
They can earn some revenue in this. And when looking at moms, when a lady gives birth and she's there in maternity and she's in that period, that 3 months period, Social Security can't give you more than 15,000. So if you're earning higher than that and you have a family, the real question is, how do you take care of your family? Yeah. So we've created the model so that it fits in with the lady doctor.
Fantastic.
Yeah.
You're also passionate about empowering women in medicine. Talk to us about that aspect of patient care.
Right, so to start off, we have ladies in our team, leaders actually. We have 2 in our board of directors. We've got a few in the management team. And also we're working with NGOs that are run by ladies specifically.
Awesome.
And again, to empower the ladies in medicine is just that. Ensuring that they can earn and live comfortably whilst taking care of their loved ones during maternity. A fun fact is next week, one of my co-founders, her name is Rose, she's also in the medical space, currently doing her PhD in Europe. She will be launching a campaign specifically for women. So it will be nice that the world looks at our social media.
Fantastic.
Yeah.
What challenges do women in medicine face today?
The one I really do know is once they've given birth and now they don't have access to that full salary. Other than that, I think Rose would be the great person to answer that because I'm a man and she's a lady and she understands ladies better than I do. But that's one of the challenges I do know, and I do know it's a huge problem, especially if a lady doctor is not married and she has to support the family on her own. The real question is, how will she support these people when she's earning much less during the 3 months of leave at work? Yeah.
Fantastic. How does patient care partner with other organizations to advance gender equality within the healthcare fraternity?
Well, we are partnered with, and we have the support of UNDP Africa that comes with United Nations. And in the next week, we'll be talking to more of those huge organizations as well. So the partnerships vary depending on the service and the value they provide, be it impact value, revenue value, or supporting the community as a whole. So if you're working with, like right now, working with 2 NGOs, one is in sickle cell, the other one is in gender-based violence, and those are 2 different organizations, so that requires 2 different types of partnership agreements. However, the main purpose is that, let's take the gender-based violence organization. The main purpose is that we have the right healthcare professionals to assist them, and also we've built a chatbot. So when one goes through depression, no one is with you at 2 a.m. in the morning or 1 a.m. So at least the chatbot can help sort out a few of that stress that you're going through until the morning kicks in and you can speak to an actual human being. If not, we've also...
So is this the AI and mental health aspect that you touched on earlier?
Yes, ma'am. Yeah.
That's fantastic.
So if the person is a bit aggressive with the bot, the AI bot, the AI then sends a response out to emergency and they can be assisted. I
love that. And also these days you can, modify your chatbots or your AI in such a way that it actually feels like you're having a human-to-human interaction. So it'll be interesting to see how that development grows.
Well, if you look on our platform in a week's time, you'll see it. So what we did is just what you said, having that human interaction, so like an actual human face talking to you and not just chatting to you. And we're adding more artificial intelligence, which is data analytics to prevent diseases. So my dad has diabetes, and also one of the strong reasons I'm super for what I'm doing. He's he recently reached the point of regulation, and we didn't celebrate with cakes, but we celebrated nonetheless. And what that means is that with AI in the forefront of patient care, then patients have the ability to prevent certain issues, like let's say breast cancer. Before it gets to stage 4 or 3, then there's certain advice and certain direction that it can give you. Also, in terms of the medication you're using, you can double check if your medication is what you are, what you need, because while the doctor is still a doctor is still a human. Sometimes you make human mistakes.
Right.
So having that confirmation is what humans do. Normally we go to Google and we start looking for stuff.
Yeah.
And you don't trust Google to be your doctor. But the point is that based on the medication, you can also then ask the AI to give you certain information. What's the pros, what's the cons, etc.
Don't you just love technology?
Yeah.
In this instance, definitely.
Yes, ma'am.
So to keep up to date with all the initiatives and plans that, you know, Patient Care has planned, you said that a lot of it will be on your social media pages as well. So for the public who's interested in seeing what you guys are doing, where can they get more information?
We are on LinkedIn, Instagram, Facebook. We have a website as well. And it's really just called Patient Care. And that's where all our information is dispersed. So by following us, they'll have easy access to this. Also, the platform is free to download, costs you nothing. And it's to the advantage to have it in their pocket. You never know when you might need a doctor.
Yeah.
And we are on iOS and Android. And if they can't find the app, then they can go on the website, and the website does have download links that sends them to Play Store and iOS Store.
That's fantastic.
Thank
Well,
you.
Jesse, thank you so much for being here this evening. This
Thank
was
you for having
very
me.
interesting. Thank you so much.
Yes, thank you.
That was Lula Schiceya, the CEO and founder of Patient Care, speaking to us there. We'll be right back after this.